Hello, everybody. Welcome to my channel. I'm Dr. Perkins, a board-certified OBGYN. And today we're talking about, can you develop endometriosis after pregnancy? Now, people often assume that pregnancy cures endometriosis, but is that actually true? Let's see what the science says. In this video today, we will talk about what is endometriosis. We'll talk about whether or not it can develop after pregnancy, and I'll dive into postpartum pain versus endometriosis pain so you can know the difference. Let's dive in. So here is a model of the uterus. We have the uterus here, fallopian tubes, and two ovaries. Now, endometriosis is a condition that affects the uterus. What happens is that the uterus has three different layers. We have the outer layer. I like to refer to that as the skin. The inner layer is like the muscle of the uterus. On the inside layer, this is called the endometrium, and this is where there is active tissue. This is the tissue that causes periods to happen. This is the tissue that supports a pregnancy. This is where the heart and the life of the uterus lives. Now, that tissue makes your period each month. It gets thicker, it sheds, it bleeds. In endometriosis, tissue that is very similar to that inside tissue is now located elsewhere in the body. It could be in your abdomen, on your fallopian tubes, on your ovaries. I've even seen this in someone's elbow. So yes, it could be anywhere. Super weird, but that's endometriosis. The problem with this is that wherever this tissue lives, it responds to the normal hormones that your body produces, telling you to make a period. So what happens is, it's that time of the month. You're having your regular menstrual bleed. This tissue, wherever it is on the inside, is doing the same thing. It is having bleeds. It is causing inflammation. It is causing chronic issues and pain. And so because of that, instead of you experiencing what I would consider to be a normal period, your period is magnified, your pain magnified. And so if you are suffering from endometriosis and you're having pain and nobody understands, I see you. It is very true, and your pain is real. Now, when we think of pregnancy quiets the state of endometriosis just a little bit. And the reason is, you're not having periods regularly anymore. You're not having periods for at least 9 months. And so because of that, this tissue isn't responding to hormones the same because your cycles are no longer happening. And so when you're pregnant, we're not curing endometriosis. We're just quieting it just for that moment. Also, it's very important to know that during pregnancy, you're not ovulating. And that is the reason that's truly behind why your symptoms might improve during your pregnancy. So now you go through your pregnancy, you deliver your baby, and now you're in your postpartum state. What does that look like? Well, the first thing is that pregnancy has a lot of hormonal changes that occurs. Postpartum does the same. I think of this as a roller coaster ride, and it goes up and down, but the height of this roller coaster ride can sometimes be in the early postpartum period. Your hormones are super chaotic. You may feel crazy, and it's not you. It's really your hormonal changes in the background that's causing you to feel the way that you do. Because of that, we may also realize that as periods begin to enter back into our world, the pain associated with endometriosis, the pain that you had before the pregnancy with your menstrual cycles, it returns, and it returns at a much greater level than it was before. Now, this doesn't happen to everybody, but it's really, really, truly common. In this state, however, it is very uncommon to develop endometriosis for the first time. There isn't much science or evidence behind that. What we find is that some people may not be aware that they had an underlying endometriosis, and now after pregnancy, it comes alive and you're just like, oh my gosh, why is my period so much more painful than they were before? The likelihood is that pregnancy changed your underlying activity in your abdomen, in your pelvis, in your uterus, and now postpartum, things are magnified greater than you were ever aware because your internal, biological, physiological environment has changed so drastically, you are now just much more aware than before. Now, if you're wondering, my periods are worse, so Dr. Perkins, are you trying to say that I have endometriosis? Not entirely. It could be, but it could also be your body just restarting on a new playing field. Here are some symptoms that you want to be aware of. In postpartum pain, we would normally expect that from the point of delivery, whether you had a vaginal delivery or a cesarean section, that your pain should improve from day to day. By week 1, you should feel much better. By week 2, you should be in a much better state. By week 4 or 5, you should be just about, I'm going to say about 80 to 90% of where you were before pregnancy. If you find that pain is increasing, the way that you're feeling is worsening from day to day, something else may be going on in the background. Now, if you are exclusively breastfeeding, you may not have a period for many, many months. If you are not, your cycle may return right around week 5 or 6 after you deliver your baby. If you do have an underlying endometriosis, the pain that comes with that first cycle may be intense. And if you find that that is you, this is where we need you to go to the doctor. This is where we need to open up the conversation with your providers, talk about your symptoms, talk about what you're feeling, talk about what you're experiencing. Now, I will say, I've treated endometriosis in my patients a ton. And one thing that I find that is really common is that patients will say, Dr. Perkins, when I have my period, I have pain specifically right here. Now, normal cramping would be midline lower abdomen. Endometriosis pain, if you have endometriosis implants elsewhere in your body, pain will be located in those locations. So for instance, because you can't see my abdomen right now, if endometriosis was right here on my fist, when your period comes, you will have pain, oftentimes, specifically in that location that you're just like, I feel pain right here. And so many times I've done surgery, taken a look inside someone's abdomen, and exactly where they complain of having additional pain during their cycles, voila, there is endometriosis right there. And so I want you to really, truly pay attention to your symptoms, pay attention to how you're feeling, and try to communicate that with your provider as best as you can. Also, the pain might not just be random on your abdomen. Sometimes it could be pain with sexual intercourse, because a lot of endometriosis can really lay on the floor of your pelvis. This is where sexual activity may activate. And so if you find that you're having extreme pain internally with sexual intercourse, that's another reason for you to have a conversation with your doctors and take a look. Now, if you didn't know, endometriosis is diagnosed by surgery, specifically laparoscopy. We take a look inside with a camera and we are able to look at your entire internal organs, and we can see to what degree we have endometriosis, whether or not we do. We can stage it and we can get a better idea of what's happening when we can't really see it on imaging. What I want you to take away is that your pain is real. Your concerns are worthy of being listened to, and it is important that we work with you to try to get a diagnosis and, most importantly, to offer you treatment. Now, I will tell you, as a medical professional myself, we're not anywhere close to where we need to be as far as being able to diagnose very well or treat endometriosis. but treatment options are available. So please talk to your provider. Please take note of your symptoms. I hope this video provided you with some additional information that will help you in your journey. Understand that, again, anything that you're feeling is real, but also understand that we are hormonal people. We change on a daily basis, and because of that, hormonal support is so important. Because you've listened all the way through to the end of our video today, I have a free offer for you. I'd love to send you a copy of my ebook, Hormones Don't Lie. This is a free copy, a gift to you for being here. If you click on the link right below this video, I'll send it right over to you. And if you want to expand on this conversation a little bit further, leave a comment. Let's talk about it. Let's support you and support others as we go on this journey called life. Thank you for being here. I'm Dr. Perkins, and I'll see you next time.